Hi, I'm Maribeth Capuno. I'm an adult nurse practitioner and I work in hepatology at the Richmond VA Medical Center. So today we're going to just discuss a couple questions that I get commonly about MASLD and MASH. One question is, how do I know if my patient has MASLD or MASH? So one of the first things you'll notice is elevation in transaminases. Usually the ALT is greater than the AST. And usually in our practice, we recommend that you get an ultrasound just for a baseline to know if there's anything else going on. If you have the ability to refer your patient for a FibroScan, if the ultrasound shows steatosis, that's a great non-invasive test that'll let us know if there is any steatosis, which is fat, or any scarring or fibrosis in the liver. Another question I get is, how do I know when to repeat the FibroScan? And again, it basically depends on your patient's risk factors. So if your patient has metabolic conditions that tend to increase the speed of fibrosis or increase their risk of continuing to develop fibrosis, things such as diabetes. And if their non-invasive testing suggests that they're at F2 or greater, you should at least repeat their enzymes and their non-invasive testing at least once a year. Usually the non-invasive testing doesn't change drastically in less time frame, but monitoring their liver function test along with their CBC, because then you can use your liver function test and your CBC to calculate a FIB4, which is a great measure to predict if they're at low risk or high risk for fibrosis. And then there's also another non-invasive blood test called the ELF test that can also help you identify if your patient's at risk for high scarring or high fibrosis levels. Thank you. These are just two common questions that we get. If you have any additional questions, please feel free to reach out at any time.